Hey guys, this is Dr. Hub. Today we'll look at the various capnographic waveforms. So to begin with, we are going to see the components of the capnograph. So capnograph, there is a x-axis and the y-axis. So the x-axis denotes the time, and then the y-axis, it is denoting the expired CO2. So it is nothing but the expired CO2. Now let's begin with some types of capnography. So first we are going to look at the obstructive airway. The first we are going to see the obstructive airway or the bronchospasm. So how does this appear? So as stated, we are seeing the x-axis with the time and the y-axis with the CO2. This is CO2 and this is time. So in terms of the bronchospasm or the airway obstruction, so there is a slight peak and then the graph is down, and next there is another peak and there is a downfall again. So this is how the bronchospasm looks. Then we move on to the type 2. The next we are going to see the expired valve malfunctioning. So how does it look in the expired valve malfunctioning? So here the graph peaks, the expired CO2, there is a plateau and then there is a peak. There is a sharp peak, there is a plateau and then there is again it is down. This resembles the letter M. So this is the expired valve malfunction. Then we move on to, let's number them. This is the third one. The third one we are going to look at the inspiratory valve malfunction. So inspiratory valve malfunction. So how does this graph look? So in this graph, it looks like a centered M. So we have a small peak, then a plateau, then a peak, then a depression, then again there's a plateau and then it comes down. So this is the inspiratory valve malfunction. Then we move on to in case of the normal physiological variant. This is the normal physiological variant, and this is seen in case of pregnant subject under GA. So it is seen again in the pregnant subject under the general anesthesia. So how does this graph look? So this graph, it slowly peaks, then there's a sudden increase, there's a gradual increase, then there is a depression, and this continues. So this is about the normal physiological variant. It is similar to that of the bronchospasm or the obstructive airway. Then we move on to the type 5. So type 5, it refers to the crurere cleft. So how does this look? So in terms of crurere cleft, there is an increase and there is a small depression. Let's go again. So there's an increase and there's a small depression, and then there is again an increase. The next unit, there's again a small depression, and then there is it comes down. So this is about the crurere cleft. Next we'll move on to the rebreathing. So this will be the sixth one. So it is rebreathing. So rebreathing is very easy to identify. So in case of rebreathing, as we discussed, the x-axis is time, y-axis is the expired CO2. So now in case of rebreathing, the graph begins, it doesn't touch the baseline, it begins, and then there is an increase. There is more of a bar graph, but there is a slightly gradual increasing in direction. So it increases, then again there is a gradual increase, then there is again a gradual increase. So the rebreathing is similar to that of a continuous bar graph. Next we move on to the type 7, that is the esophageal intubation. So we look at the esophageal intubation. So under esophageal intubation, the graph is a beautiful one. There is a big graph, there is a big peak, and then it oscillates. There is a smaller. This is the esophageal intubation. Then we move on to the spontaneous breathing. This will be we have seen 7, so this will be number 8. This is the spontaneous breathing. Spontaneous breathing is also very easy to identify. So we have the time in the x and the expired CO2 in the y. So this is nothing but multiple peaks. So there's a peak here, then again there's a peak, then again there's a peak, and all of them have the same amplitude peaks. So this is the spontaneous breathing. So this was number 8. Then we move on to number 9. Number 9, there is a single lung transplant. This is a single lung transplant. So it appears there is a 90-degree upwards, and then there is down. There's a notch, then it gradually increases, and then it comes down. So this repeating units. There's a notch, there's an increase, and then it comes down. So what is the explanation? The dual capnogram in one lung patient. This is known as the dual capnogram. This is in case of the single lung transplant. So it is a dual capnogram in one lung transplant patient. The first peak in phase 3 is from the transplanted normal lung. So the first peak is from the transplanted normal lung, and whereas the second peak is from the native lung, diseased lung. Second is from the native. Second peak is from the native diseased lung. So a variant of the dual capnogram, that is a steeple sign capnogram. So it is a steeple sign capnogram, and it is seen if there is a leak. So a dual is seen in case of there is a leak. So there is a leak around the side stream sensor port at the monitor. Like a leak around side stream sensor port of monitor. Sensor port of the monitor. Next we move on to, so I've seen so many bronchospasm, expiratory valve malfunction. So this will be number 2, 3, 4, 5. This is going to be the number 10. So under number 10 we will see the malignant hypothermia. So number 10 is the malignant hypothermia. So under malignant hypothermia, let's see the graph. So the graph is like a hanging continuous bar graph. So So this is malignant hyperthermia. So there is a bar graph with a gradual upward incline. Again, so this increases in size. So this is nothing but the malignant hyperthermia. So this was number 10. Then we'll move on to the number 11. So how does the number 11 look? So under number 11 we are going to look at the cardiac oscillations. So we're going to look at the cardiac oscillations. So what does this include? So in terms of the cardiac oscillation, there is a 90-degree turn, and then there's a 90-degree turn, and then there's a plateau, and then it oscillates. It comes down, and then again this continues. There's again a 90-degree turn, then it oscillates. So here there's a classic ripple effect. This is known as a ripple effect. It is a ripple effect, and this ripple effect is during the expiratory pause. So this is during expiratory. This is during the expiratory pause, and it shows a cardiogenic oscillations. Shows cardiogenic oscillations. Then we move on to number 12. So number 12 is nothing but the contamination of the sensor. So we are looking at the contamination. This is of the sensor or the soda lime. So this is of the sensor or the soda lime exhaustion. So here the graph is like a bar graph, but here it is, the edges are curved. So this is the contamination sensor or the soda lime exhaustion. So it increases with the size. So as we discussed, the edges are blunt. Next we move on to the type 12. So here if you see, there is a sudden rise in the baseline and end tidal PCO2. This is due to the contamination of the sensor with secretions or the water vapor. So this is something to remember. Then we move on to the type. So we have already seen. Now we'll move on to the type 13. We have seen type 12. In terms of type 13, we are going to look at the intermittent mechanical ventilation. Intermittent mechanical ventilation, and in short it is known as the IMV. And this is in midst of the spontaneous breathing. In midst of the spontaneous breathing. So how does this graph look? So in the x-axis we have the time, and y-axis we have the CO2. So the graph, if you see, there is a slight increase, and then comes the big plateau, then again there is a slight increase. This is the intermittent mechanical ventilation. So these breaths in the midst of the spontaneous breathing patient. So this happens in midst of spontaneous breathing patient. In midst of spontaneous breathing patient. Next, let's move on to the 14th variety, that is the cardiopulmonary resuscitation. So this is a cardiopulmonary resuscitation. So here in the x-axis there is a time and y-axis there is a CO2, expired CO2. So here how does the graph look? The graph is very much towards the baseline. So there are some irregular peaks and downfall. So this is the cardiopulmonary resuscitation. So here the capnograph, it shows a positive waveform during each compression. So during each compression there is a positive waveform seen. Next we are looking at the last, so this will be the 15th capnography we are seeing. So here this will be the rebreathing during inspiration. So this will be the rebreathing during inspiration. This is in case of the Bain Mapleson D circuit. Is also in case of Mapleson D circuit. So here the capnograph, let's draw it. So here there are some irregular patterns. That is, first they can be decrease and then the plateau, and then there's a mild decrease and an increase. So here the capnograph, it shows a rebreathing during the inspiration. This is a normal in rebreathing circuits. So it shows rebreathing during inspiration, as well as it is very normal. It is normal in terms of the rebreathing circuit such as the Mapleson D, that's what we discussed, Mapleson D circuit, as well as in case of the Bain circuit. So this was all about the capnography and very important capnographic findings with their respective diseases. So to learn and grow daily like this, please do subscribe.